Top 7 vitamins to strengthen your legs. Prevent leg cramps in seniors. Did you know 1 in 3 people over 65 falls each year, and most of those falls are due to weak legs? That number isn't just a dry statistic. It's a wake-up call for millions of seniors across America. People who were once healthy, walked normally, and then one day found themselves reliant on a walker just because of a small fall. Ironically, the weakening of legs doesn't happen suddenly. It starts silently, from nighttime cramps in the middle of the night, from a tingling sensation after standing too long, or simply from legs that are no longer as agile as they used to be. Many people think this is just a sign of aging, but the truth is, it can absolutely be prevented. I'm a senior healthcare expert working at a care center in the Western United States. Over the past 15 years in this field, I've seen many people who once accepted a life of dependency return to walking steadily, just by understanding and applying the right knowledge about nutrition. Because leg strength doesn't just come from exercise, it also comes from how you nourish them every day. In this video, I'll share with you 7 vitamins and some essential minerals that seniors' legs can't do without. These nutrients don't just strengthen muscles, improve reflexes, and reduce pain. They also prevent unexpected falls, the leading cause of seniors losing their independence. I won't stop at just theory. I'll tell you real stories, analyze common mistakes, and suggest small daily dietary changes that can make a huge impact. And if you're caring for parents, grandparents, or you're stepping into your 60s or 70s yourself, then today's content could be a game changer. Watch the entire video, because you might be holding the key to walking confidently throughout your aging journey. If you find this video helpful, please hit the like button and subscribe to the channel so I'm motivated to share more valuable information. But if you're not convinced, don't hesitate. Leave the number 0 in the comments. I'll read everything and improve in the next video. The first one I want to talk about is vitamin D, a nutrient that seems simple but has a profound impact on every step you take. Seniors often think that leg weakness is natural, but most don't realize that a lack of vitamin D is one of the most silent and dangerous causes. It doesn't just make bones brittle and prone to fractures, it also causes muscles to lose their ability to react flexibly, which is crucial for maintaining balance and preventing falls. The human body can synthesize vitamin D from sunlight, but as we age, the skin becomes less efficient at absorbing and converting sunlight into this nutrient. Add to that the fact that many seniors live indoors, rarely go outside, or cover up too much due to fear of skin cancer. All of this causes vitamin D levels in the body to drop without anyone noticing. It's no coincidence that a study published in the Journal of Clinical Endocrinology and Metabolism found that over 60% of people over 65 in the US have some degree of vitamin D deficiency. This deficiency directly affects muscles. Vitamin D doesn't just aid in calcium absorption, it also plays a role in protein synthesis, helping to maintain and rebuild muscle fibers. Without D, muscles don't just weaken, they lose the ability to react quickly. Fast twitch muscles, the type that help you stay balanced when you trip or misstep, are the first to decline. That's why many seniors react slowly when they lose balance, leading to falls that can easily cause serious injuries. I once worked with a 74-year-old man who used to be very healthy, walking over 3 kilometers every morning. But after a winter spent mostly indoors, he started feeling leg weakness, frequent stumbling, and then nightly cramps. A blood test showed his vitamin D levels had dropped below normal. After just 3 months of supplementation combined with guided sun exposure, his condition improved significantly. He returned to his walking routine, no longer had shaky legs or sleepless nights due to cramps. It all started with adjusting one seemingly small vitamin. Surprisingly, the benefits of vitamin D don't stop at muscles and bones. It also helps reduce inflammation, a factor behind chronic leg pain that many seniors dismiss as aging aches. When vitamin D levels are stabilized, symptoms like calf stiffness, soreness from standing too long, or a heavy feeling in the thighs decrease significantly. This isn't just a feeling, it's the result of real biological changes happening in the body. The problem is, we can't clearly detect a vitamin D deficiency through everyday sensations. It happens silently, without causing fever or immediate exhaustion. But over time, it leads to bones losing calcium, muscles losing strength, and the nervous system losing precise control. If you're feeling that climbing stairs has become more taxing, or standing up from the sofa requires more effort than before, it might not be age. It could be the first sign of a body lacking vitamin D. The question is, how can you maintain stable vitamin D levels in a safe way? The first answer is sunlight. About 15 to 30 minutes a day, in the early morning or late afternoon, exposing yourself to sunlight without fully covering up with thick clothing or using overly heavy sunscreen. That's the most natural way to synthesize vitamin D. But this isn't always feasible, especially for seniors in nursing homes, apartments without balconies, or those living in cold climates. In those cases, supplementation through food and pills is a reasonable option. Salmon, mackerel, egg yolks, sun-exposed mushrooms, milk, and fortified cereals are foods that can sustainably bring vitamin D back into the body. However, many experts recommend seniors get regular blood tests to know their exact vitamin D levels, so they can determine the appropriate supplementation dosage. Typically, 800 to 1,000 international units per day is a safe level, but for those with severe deficiencies, a doctor might prescribe higher doses for a short period. One important thing to note, vitamin D doesn't work in isolation. It needs the presence of calcium to fully exert its effects in protecting bones and muscles. Conversely, if you supplement vitamin D without enough calcium, the body can't fully utilize the vitamin D, and the effectiveness in preventing osteoporosis or cramps will be significantly reduced. So when you start paying attention to vitamin D, look at the bigger picture. It's the entire nutritional ecosystem supporting your legs, not just a magic pill. The benefits of vitamin D have been proven through numerous studies over many years. People with optimal D levels not only have stronger muscles, but also experience less joint pain, fewer hip fractures, and better sleep quality. For those feeling that each step seems heavier, start with the simplest thing. Check your vitamin D, because this silent nutrient might just be the first key to unlocking a journey back to stability, confidence, and freedom in every step. The second one I want to talk about is calcium, a name so familiar that it's often overlooked. But if you've ever seen an elderly person fracture their femur just from missing a step, you'd understand that calcium isn't just a mineral for textbooks. It's the final barrier between the freedom to move and months of dependency on others. Calcium isn't just the building block of bones. It also acts as a signal for every muscle contraction that happens when you walk. The adult human body contains about 1 to 1.5 kilograms of calcium, with over 99% of it in bones and teeth. The rest circulates in the blood, regulating heart rhythm, muscle contractions, and nerve signaling. When blood calcium levels drop, the body automatically pulls calcium from the bones to compensate, and that's when you silently start losing your solid foundation. This process doesn't cause immediate pain. You won't hear your bones creak as calcium is taken away. But over time, areas of bone that were once dense become porous, fragile, ready to break with the slightest impact, like a slip in the bathroom or simply tripping over the edge of a rug in the living room. I once cared for a woman named Grace, 82 years old. She fractured her hip while bending down to tie her shoelaces. No fall, no collision, just a bend and a tiny crack she still remembers vividly. Tests showed her bone density was 35% below average. She ate 3 meals a day, drank milk regularly, but hadn't supplemented calcium for the 15 years since menopause. It was like building a 3-story house but letting the foundation erode day by day. The building might stand until one day, it collapses. What many people misunderstand about calcium is thinking that drinking milk is enough. But the body's ability to absorb calcium from food decreases significantly with age, especially when stomach acid production isn't as robust as before. Many seniors also suffer from lactose intolerance, making milk consumption cause bloating, diarrhea, or discomfort. In such cases, calcium from greens, nuts, tofu, sardines with bones, or fortified plant-based milks become safer and more effective options. However, absorbing calcium isn't just about what you eat. It requires coordination with other nutrients. First and foremost, vitamin D. If vitamin D is the key that unlocks calcium absorption, then without it, everything you put into your body might go to waste. That's why many people who supplement calcium regularly still can't improve bone density if their body lacks vitamin D, a fact confirmed by numerous studies on seniors in nursing homes and communities. It doesn't stop there. The body also needs movement to signal, I still need the skeleton to be strong. If you only sit and don't move, the body assumes the bones no longer need to bear much load and gradually reduces investment in reinforcing them. That means calcium won't be prioritized for the bones. It'll be excreted or deposited in the wrong places. That's also why people bedridden for long periods lose bone mass so quickly. Conversely, just 30 minutes of walking a day can stimulate bone regeneration in a positive way, something no pill can fully replace. Some people choose to supplement calcium with pills, which is reasonable in many cases. But be cautious. Too much calcium, especially from high-dose tablets, can lead to deposits in the kidneys or blood vessel walls if there isn't enough magnesium and vitamin K2 to guide it. It's like building a house. You can't pour concrete everywhere without an architect directing it. So when supplementing calcium, always remember, balance is key. Ideally 1,000 to 1,200 milligrams per day from a combination of food sources, and if needed, work with a nutritionist to design a safe, reasonable supplementation plan. Another thing I often remind my elderly patients is to pay attention to small signals. If you're experiencing more frequent cramps, brittle nails that break easily, or calf soreness during light activity, it might not just be a muscle issue. It could be your body's way of saying, I'm lacking building materials. And if you listen early, you can avoid months of lengthy recovery in the hospital from a fall that seemed harmless. Legs don't just need to be strong, they need to be steady. And to have that steadiness, you have to start with the structure, the foundation. Calcium won't make you walk faster, but it makes every step more secure, reassuring, and free from the shadow of fear. Because losing balance isn't just a physical issue, it also erodes your confidence in yourself. The third one I want to talk about is vitamin B12, a small nutrient with an unimaginable impact on how your legs move every day. If calcium is the hardware that builds the structure, then B12 is like the nervous system's operating system, coordinating every signal between the brain and muscles. When deficient, even the simplest movements, like standing up from a chair or stepping to the side, become unstable, no longer as steady as before. Vitamin B12 plays a crucial role in maintaining the myelin sheath, the insulating layer around nerves. When this layer weakens, signals from the brain to the muscles are no longer transmitted quickly and accurately, making limbs clumsy, sluggish, or even numb. Many seniors describe feeling like their legs aren't theirs anymore, or I walk without knowing I'm walking. These seemingly strange descriptions are actually very typical symptoms of prolonged B12 deficiency. I once spoke with a 70-year-old man, a former mechanical engineer, very meticulous and precise in every movement. He started noticing his hands trembled more when holding tools, and his legs reacted slowly when stepping over a threshold. At first, his family thought it was a normal sign of aging, but it wasn't until he fell twice in the same month that they took him for a thorough exam. The results showed his vitamin B12 levels were below the minimum threshold, and the nerves in his lower limbs were starting to be damaged. After 3 months of treatment with high-dose B12 supplementation and physical therapy, he was able to walk normally without a cane. What I'll always remember is what he said. I didn't think something so small could decide how I walk. The risk of B12 deficiency in seniors is much higher than in younger people because absorption depends on a type of stomach acid and a protein called the intrinsic factor, which the body produces less of over time. Those with chronic gastritis, who take acid-reducing medications or have a history of stomach surgery, are among the most at risk for B12 deficiency. Even some who eat a fully balanced diet can still be deficient because their body no longer absorbs it well. B12 deficiency symptoms are sometimes mistaken for signs of dementia, depression, or Parkinson's because patients may feel confused, forgetful, or lose coordination in their limbs. The good news is, if caught early, damage from B12 deficiency can be fully or nearly fully reversed. The sad part is that many let things go too far before getting a proper diagnosis. Foods rich in B12 are typically animal products like beef liver, eggs, salmon, tuna, chicken, and milk. For vegetarians, B12 supplementation becomes critical through fortified foods or pills, as there are almost no natural B12 sources in plants. And even for meat eaters, if they have digestive issues, they might still need B12 injections or sublingual forms to ensure absorption. What's interesting is that B12 is one of the safest vitamins to supplement. The body excretes excess through urine. However, that doesn't mean you should take it recklessly. It means you should get regular blood tests, especially if you have symptoms like numbness, heavy legs, loss of sensation in the feet, or frequent tripping for no apparent reason. Not everyone with weak legs needs to start exercising right away. If the nervous system controlling your legs isn't functioning accurately, all your efforts to move might backfire. First, you need to ensure the signals from your brain to your muscles are being transmitted fully and clearly. B12 is an indispensable part of that complex neural wiring system. I often tell my patients, muscles can be trained, but nerves need to be nourished. If you feel your legs aren't steady, if you have to look down at your feet while walking to make sure you're stepping correctly, then consider vitamin B12. Because what's holding back your steps might not be age. It might be a silent, subtle deficiency that can absolutely be improved if you catch it and act in time. The fourth one I want to talk about is magnesium, a mineral often overlooked, but acting as the silent coordinator behind every movement in your body. If a lack of calcium weakens bones and a lack of B12 slows nerve transmission, then a lack of magnesium makes your legs react chaotically. Sudden spasms, unexplained fatigue, or numbness without clear cause. I've called magnesium the silent conductor in the orchestra of movement, because when it's gone, the rhythm disappears. Every time you lift your leg, thousands of muscle fibers are contracting, and thousands of others are relaxing, following a precise neural command down to milliseconds. Magnesium helps those fibers know when to relax. Without enough magnesium, your body is like an arm that keeps squeezing and won't let go. Cramping, twitching, trembling, especially at night. Those sudden cramps at 2 a.m. that wake you up, clutching your calf in pain. That's the language of magnesium deficiency. Many people mistake this for sciatica or varicose veins, but it's often just the body lacking enough magnesium to relax muscle fibers that are constantly working. During checkups, I've met elderly men and women who came in simply because my legs are tired all day, my legs twitch at night, or it feels like pins and needles under my feet. In many cases, after adjusting their diet and supplementing magnesium appropriately, they return to deep sleep, something they thought they'd lost forever with age. The unfortunate thing is that magnesium depletes easily and often goes unnoticed. Chronic stress, diuretics, stomach medications, or a diet lacking greens all cause magnesium to be excreted faster than usual. In modern society, who can avoid stress, medications, and processed foods? That's why magnesium is one of the most commonly deficient minerals, especially in seniors. According to a survey by the U.S. National Institutes of Health, up to 70% of adults don't meet the daily recommended magnesium intake. Magnesium also supports nerve transmission and maintains a steady heart rhythm. But for legs, its most important role is preventing muscle spasms and maintaining flexibility. With enough magnesium, you feel lighter when moving, less tired after walking, and less likely to experience that heavy leg feeling, as if you're carrying something invisible. It's not a miraculous recovery. It's simply your body getting the nutrient it needs. Magnesium-rich foods aren't rare, but they're often overlooked in daily meals. Pumpkin seeds, almonds, spinach, black beans, oats, bananas, avocados, all are easy to find and prepare. The key is that they need to be consistently present in your diet. I often suggest patients switch their breakfast from white bread to oatmeal mixed with pumpkin seeds and sliced bananas. Simple, affordable, and the effects are noticeable within 1 to 2 weeks. In some cases, when diet isn't enough, or for those with absorption issues, magnesium supplements should be considered. Forms like magnesium glycinate or citrate are often recommended because they're easier to absorb and less likely to cause digestive upset compared to oxide forms. However, more isn't always better. If taken in high doses incorrectly, magnesium can cause diarrhea or interact with certain medications. So supplementation should always come with a doctor's or nutritionist's guidance, especially if you're on multiple medications for chronic conditions. One thing I always emphasize to seniors is leg fatigue isn't your fate, cramps aren't normal, and sleepless nights because your legs keep twitching shouldn't be accepted as a must-have part of aging. These things can change, and magnesium is one of the most effective, accessible tools you can use. No one sees magnesium working in your body. It doesn't glow, it doesn't ring a bell, but you'll notice when it's missing. Steps that lose their rhythm, sleep torn apart, and a tense calf feeling as if your body is sending a distress signal. If you've ever felt your legs aren't listening to you, look at your diet and medication history. Because maybe a small adjustment related to magnesium could bring you back to the rhythm, comfort, and flexibility that's rightfully yours. The fifth one I want to talk about is potassium, a mineral that sounds familiar but is easily underestimated until you wake up in the morning with a cramp so intense you have to clutch your calf in pain. Those unannounced muscle spasms, the sharp jolts as if someone is pulling the tendons inside your leg, that's the classic sign of potassium deficiency. And the thing is, this condition doesn't just cause discomfort, it leads to a series of more serious consequences, especially for the steadiness of each step seniors take. Potassium regulates electrolyte balance in muscle cells while maintaining osmotic pressure between the inside and outside of cell membranes. When blood potassium levels drop, muscles lose their ability to contract and relax rhythmically, leading to cramps, mild tremors, and sometimes a shaky feeling in the legs after standing too long. Not everyone realizes this is due to potassium. Many think they're dealing with vascular issues or joint degeneration, but in reality, simply adjusting potassium levels can quickly turn things around for the better. I once treated a 67-year-old male patient who was very active, but constantly complained that his legs felt like they were vibrating when he stood for too long. He also frequently tripped or misstepped, even though his vision was fine. After testing, we found his potassium levels were below normal. It turned out his diet lacked fresh vegetables. He followed a low-carb diet and was worried about blood sugar. Cutting out potassium-rich foods like potatoes, bananas, oranges, and beans caused a severe mineral deficiency. After 3 weeks of adjusting his diet, adding more greens and a small amount of potassium supplementation, the leg trembling disappeared completely, his sleep improved, and his balance noticeably enhanced. This shows that potassium isn't just an electrolyte, it's a deciding factor in muscle and nerve stability. In movement, potassium acts as a bridge, transmitting signals between the brain and muscles. When this signal is disrupted, muscles react slowly, out of sync, increasing the risk of tripping, a dangerous thing for seniors. A fall isn't just about losing balance. For many, a single fall can end their ability to walk independently, and sometimes the last bit of freedom they have left. Beyond muscles, potassium also directly impacts bone health. Not many know that potassium helps neutralize acids in the body, thus slowing bone loss over time. A diet high in acidic foods, like red meat and processed foods, prompts the body to pull calcium from bones to balance pH. Potassium from fruits and vegetables helps prevent this, keeping bones from eroding silently. So supplementing potassium isn't just about preventing cramps, it's an investment in strong bone density, a prerequisite for protecting legs from fractures during unexpected impacts. Potassium-rich foods are abundant and accessible. Bananas, sweet potatoes, pumpkins, spinach, oranges, lentils, even yogurt and avocados. A baked sweet potato can contain nearly 500 milligrams of potassium, double that of a banana. Many think eating one banana a day is enough, but in reality, the recommended potassium intake is about 2,600 milligrams for women and 3,400 milligrams for men daily. This means you need to diversify your food sources instead of relying on a single item. In some special cases, like patients on diuretics or high blood pressure treatment, doctors may require closer monitoring and adjustment of potassium, as dehydration and electrolyte loss can happen quickly and directly affect the heart. But for most healthy people, a diet rich in fresh vegetables, whole grains, and fruits is enough to maintain stable potassium levels, helping legs move rhythmically and confidently. I always tell my patients, there's nothing worse than legs that don't obey you. And when you feel your legs trembling, stiff, or slow to react, don't just think of joints or age. Think of the electrical signals being disrupted in each muscle fiber. Think of potassium, the silent mineral that keeps everything connected smoothly. Because a steady step doesn't just need strength, it needs perfect coordination between sensation, signal transmission, and mechanical response. And all of that sometimes starts with a plate of greens or a hot potato at lunch. The sixth one I want to talk about is vitamin K, a nutrient rarely mentioned when it comes to leg health, but acts as a silent gatekeeper for both bones and joints. If you're supplementing calcium, walking regularly, and taking care of every meal but still hear your knees creaking, feel your joints stiffen every morning when you wake up, then your body might be missing a key component, vitamin K. Unlike vitamin D or calcium, which are widely featured in health magazines, vitamin K is quieter, more modest. But its function is far from small. It's the navigator, ensuring the calcium you take goes to the right place, not into blood vessel walls, not deposited in soft tissues, but straight to where it's needed most, the skeletal structure. Without vitamin K, calcium can get lost, causing stiff joints, clogged arteries, and even more dangerously, forming plaques that narrow blood vessels, something no one wants, especially when you've reached an age where you need ease in every movement. Vitamin K also activates a protein called osteocalcin, like a hook that helps calcium latch securely onto bones. Without osteocalcin, calcium, even if present, can't bind tightly to the framework, making bones brittle and porous. Symptoms like knee pain when standing up, a loose feeling in the joints when stepping downstairs, or the creaking sound every time you bend your knees can all be linked to a long-term vitamin K deficiency. I once worked with a 75-year-old woman who complained that every morning when she woke up, her knees felt locked, requiring massage or walking for a while to loosen up. She had tried fish oil, glucosamine, even joint injections, but the effects only lasted a few weeks. After reviewing her diet, we found she hadn't eaten leafy greens for 2 years because she feared bloating, and she was on blood thinners, a factor that further limited vitamin K. After 6 weeks of adjusting her diet, adding kale, spinach, and a bit of natto, a fermented soybean dish rich in vitamin K2, she returned with a more fluid gait, less pain, and her joints no longer made noticeable creaking sounds. What's worth noting is that vitamin K doesn't come in just one form. Vitamin K1 is mainly found in leafy greens, spinach, kale, lettuce, broccoli. Meanwhile, K2 comes from fermented foods like annatto, cheese, animal liver, and egg yolks. K2 is considered more effective at directing calcium to bones and reducing deposits in arteries. Recent studies show that people with stable K2 levels have less arterial calcification, less knee pain, and maintain better bone density as they age. For those on blood thinners, supplementing vitamin K requires extra caution because it can reduce the drug's effectiveness. But that doesn't mean you should avoid it entirely. On the contrary, experts recommend maintaining a consistent daily vitamin K intake rather than having it sporadically, so the medication can work effectively while the body is still protected. It's about balance, not elimination, but smart coordination between treatment and nourishment. Vitamin K also plays a surprising role in movement coordination. Recent studies have found that it's linked to muscle function and nerve control, especially in the lower limbs. When vitamin K levels are low, the body's ability to maintain balance and react to unstable situations, like slipping or misstepping, is noticeably affected. A study from Tufts University showed that seniors with higher vitamin K levels in their blood performed better in balance tests, walked faster, and had fewer falls compared to the other group. It's easy to overlook vitamin K because it doesn't create an immediate sensation. You don't feel hungry for vitamin K, but you can feel its absence. Stiffer knees, weaker bones, bruises that take longer to heal, joints that creak with every movement and every step requiring heightened attention, as if the body no longer operates naturally. Legs don't just need to be strong, they need to be flexible, resilient, and quiet when in motion. No machine works well when its parts keep creaking. Vitamin K helps everything run smoother, quieter, and more sustainably over time. A plate of boiled greens, a bowl of spinach soup, a bit of fermented beans. Sometimes simple things like that can keep your knees from creaking and make your steps feel as natural as they did when you were younger. The seventh one I want to talk about is vitamin B6, a nutrient that seems understated in discussions about musculoskeletal health, but is a key factor in keeping muscles nourished, nerves protected, and movement smooth. Without vitamin B6, your legs might still move, still walk, but inside there's a lurking exhaustion, slower reactions, and growing instability that becomes more evident over time. Vitamin B6 is involved in hundreds of metabolic processes in the body, including critical reaction chains related to nerve transmission and the formation of hemoglobin, the molecule that delivers oxygen to muscles. When B6 is deficient, blood can't supply enough oxygen to the calves, making you feel fatigued even after walking just a few steps. A healthy person might climb 2 flights of stairs without stopping, but for someone lacking B6, each step feels like a battle. Knee fatigue, heavy calves, weakness, and shortness of breath. These are often blamed on aging, but aging doesn't come that suddenly. It comes when you let small deficiencies build into big consequences. I remember a female patient, 66 years old, who came in with a very hard to describe feeling. My legs aren't tired, but they have no strength, like they won't listen to me. She didn't have osteoporosis or sciatica, but throughout our conversation, she kept emphasizing that I can walk, but after 3 minutes, I feel like I need to sit down. Test results showed a severe vitamin B6 deficiency. After a month of consistent supplementation per the protocol, combined with a B6-rich diet, she returned with a gentle smile and said, I want to walk to the park every afternoon again. Vitamin B6 also helps reduce inflammation, the silent destroyer of joints and muscles throughout the aging process. When tissues are inflamed, nerves become more sensitive, leading to tingling, pins and needle sensations, or even numbness in the toes. This is why many seniors walk unsteadily, not because of bones or muscles, but because they no longer fully feel the ground. The communication between the body and the environment has been interrupted. B6 is one of the nutrients that helps restore that dialogue. So your feet know when to grip firmly, when to relax, and when to react quickly to maintain balance. B6-rich foods aren't hard to find. Salmon, chicken breast, bananas, potatoes, chickpeas, sunflower seeds, whole grains. But the key is they need to be present regularly. B6 doesn't store long in the body, so neglecting it for days, weeks, then months is very common, especially in seniors with nutrient-poor or monotonous diets. Sometimes just because they're reluctant to cook or change their meals, the body misses out on what it needs to keep functioning fully. For those with absorption issues, supplementing B6 through pills is a safe option, with a reasonable dose of 1.5 to 2 milligrams per day. However, long-term high doses shouldn't be done without guidance, as they can cause peripheral nerve damage. It sounds paradoxical but true. If you supplement too much B6 for too long without control, the very nerves you're trying to protect can be affected. So the right thing isn't to take a lot, it's to understand how much your body needs and nourish it sufficiently and consistently. Vitamin B6 doesn't make you feel better right after a meal, but if it's missing, you'll notice it every time your legs react a beat slower, every time climbing a slope feels unusually tiring, or every time you have to stop to massage your legs because they feel weighed down. Those small signs are your body's whispers, and if you listen and adjust with simple foods, you can help your legs return to the state they deserve: flexible, steady, and full of vitality. Everything I've shared today isn't grand advice, nor is it an instant solution. These are just small pieces in the bigger picture you're holding, a picture that can be redrawn, adjusted bit by bit from the simplest choices. A plate of greens, a glass of fortified milk, a small supplement taken consistently after breakfast, a decision to walk every afternoon instead of sitting inside all day. Those seemingly small things are the start of long-term stability. You don't need to change everything in one day, but if today you've realized something new or noticed your body is quietly lacking something, then start there. Don't wait until a fall happens to start protecting yourself. Don't wait until you lose control to realize you once had the power to take charge. Your body never betrays you. It only responds to how you care for it. And your legs, even if they're trembling or weakening, can become strong again if you give them the conditions to recover. I believe everyone has the ability to be their own body's guardian. No one knows your daily steps like you do. No one feels the stumbling, fatigue, or loss of control better than you. So no one can decide for you where to start. You can start by checking your diet, from a simple blood test, from asking your doctor a clear question you've been leaving unanswered, or simply from a question, have I cared for my legs well enough? If you found this video helpful, I'd truly appreciate it if you hit the like button and subscribe to the channel. That's how I know this information is valuable to you, and it motivates me to keep bringing more practical content.